Hello everyone. In this video, we are going to discuss about what is pilonidal sinus, in which group of people this pilonidal sinus happens, why pilonidal sinus happens, what are all the treatment options available for pilonidal sinus, and what aftercare is to be taken after getting operated for pilonidal sinus, and what measures to be taken for this pilonidal sinus to not happen again. To start with, what is pilonidal sinus? Let's split the word pilonidal sinus. Sinus is nothing but a small tract, which pilus means nothing but a tuft of hair. So, to put together, pilonidal sinus is a tuft of hair which has lead to a small sinus tract leading to discharge of pus or fluid. So, where exactly this pilonidal sinus happens? It happens in between both the buttocks. Why this pilonidal sinus happens? So, to start with, there are three triggering factors for this pilonidal sinus to happen. First triggering factor is the hair. Second triggering factor is the pressure. Third triggering factor is the skin. So, first let's talk about the hair. So, it's not because of the hair over the head this pilonidal sinus happens. It's because of the hair over the back, starting from the shoulder till the level of buttock, especially in hairy individuals or people with stiff or coarse hair. So in this group of people, due to excess hair or the nature of the hair is so coarse, so in this group of people, whenever there is hair fall, all this deposited hair gets accumulated in between the buttock regions. So that is one of the triggering factor. And the second factor is the pressure. So all this deposited hair, if this gets subjected to pressure, how? Be it in people with prolonged sitting or be it in people with obesity. What happens in obesity? So suppose if this is the left buttock and this is the right buttock. So if the patient is thin build, so the buttocks will be like this. If the patient becomes obese, what happens? The fat deposition occurs in both the buttocks, thereby the buttocks gets high, thereby the space or the depth between the interbuttock region increases. So in obesity people, so as the depth in between the buttocks increases, so whenever they walk for long durations, there will be some amount of friction, and what happens is the already deposited hair, just because it is getting subjected to friction, it starts penetrating into the skin, and this tuft of hair, once it penetrates into the skin, it starts developing infection. Thereby they start slowly observing some fluid or sometimes pus coming out in between the interbuttock region. So the third triggering factor is the skin, as we discussed. So apart from the hair and the pressure in between the buttock region, the skin susceptibility also matters. Why this skin susceptibility, how it affects is in people with excess sweat production or in people with obesity, as we discussed earlier. So there will be excess amount of sweat production, and this sweat makes the skin wet. So take for example, if a person goes to a swimming pool or if a person spends 1.5 to 2 hours in a beach, after coming out of the water, he can see the skin becoming very thin or much susceptible to infection or injuries. After coming out of the beach, many people do observe small cuts happening over the foot. They don't even notice when that happened, but they only notice after coming out of the water. In the same way, this sweat also makes the skin over the interbuttock region susceptible to infections and injury. So apart from the hair, apart from the pressure, if the skin is sweaty, so that may incite the hair to go in or penetrate inside the skin, and this tuft of hair, once it penetrates, it triggers infection and slowly it starts developing a pus which will be discharging from the intergluteal cleft region. So mainly it is located at the end of the tailbone, which the worst part is most of the patients may not be able to see what exactly is happening on their back. But the most common location for this pilonidal sinus is at the end of the tailbone, because that is the most susceptible pressure zone in people with prolonged sitting. Because this pilonidal sinus happens in the region of tailbone, and especially it happens in people with prolonged sitting, especially for truck drivers and jeep drivers. This pilonidal sinus is also referred to as jeep driver's disease because it happens in people with prolonged sitting.